We've always known about allergies. We can look back to the Chinese doctors who described a plant fever that caused a runny nose around 3,000 years ago, or to the Roman philosopher Lucretius who wrote, "What is food to one is to others bitter poison." It wasn't until the early 1900s, though, that we started to realize that all these issues could be caused by the same thing. At this point, researchers understood that bacteria and other pathogens could cause disease, as our immune system worked to fight off the harmful invaders. What we didn't understand is that our immune system could also cause harm. The belief up until this point was that our immune system would slowly build antibodies to protect us against these infectious diseases. As you can probably guess, though, things aren't that simple. According to a 2015 BBC article, experiments and studies were conducted, and scientists found that sometimes our system couldn't create these antibodies, but instead would become more sensitive as exposure was increased. This discovery led Austrian Dr. Clemens von Perkay to coin the term allergy, which came from the Greek word allos, meaning other, and ergon, meaning work, and the rest was history. But wait, how exactly do allergies work then? Symptoms like sneezing, itchy eyes, hives, and even breathing problems happen when an allergen enters your body and your immune system begins to overreact. Your system views this as an unwelcome guest and begins to produce a special antibody to fight the allergic substance. If the allergen enters your body again, your system kicks it into high gear, which causes a series of reactions. According to Dr. Robert H. Oliver, these reactions can include tissue destruction, blood vessel dilation, and the production of inflammatory substances like histamine, which ultimately results in those symptoms we mentioned earlier. This cycle just goes on until a remedy is added to the mix. Now that we know how allergies were discovered and how they work, let's jump into the most common ways these pesky little allergens can enter your body. The first way an allergen can enter your body is through skin contact. Contact dermatitis happens when you touch something and your body has a reaction to the substance. This can be caused by things like makeup, perfume, jewelry, and even plants. There are plenty of symptoms out there, but some include redness, itching, blistering, and rashes. This type of reaction can typically be treated with anti-itch cream, though. The second way an allergen can enter your body is through ingestion, but we probably know these more as food allergies. As you can figure out, this type of reaction is brought on when you consume an allergen. There are plenty of food allergies out there. Some you may have heard of include peanuts, eggs, dairy, and fish. Everyone reacts differently, but symptoms can include swelling, an itchy mouth, dizziness, and difficulty breathing. For moderate to mild reactions, some good old antihistamine should help calm down these symptoms. But for more serious situations, you may use an adrenaline shot like an EpiPen to help reduce your reaction. The third way an allergen can enter your body is through inhalation. This occurs when an allergen enters through your nose or mouth and ultimately ends up in your lungs. You probably think of things like dust, pollen, and pet dander. Similar to the other types we've covered, common symptoms include runny nose, itchy throat and eyes, and coughing. This type of reaction is typically less severe and can be managed with over-the-counter medicine. The final way an allergen can enter your body is through injection. This one is a little more niche, but is brought on by insect stings. That's right, I'm talking about those happy little pollinators. While everyone has some type of reaction to a bee sting, someone who is truly allergic to the insect's venom can experience some serious symptoms afterwards. Like with the other allergens, the proteins within the venom begin to affect the immune system. This can bring on symptoms like hives, swelling of the face and tongue, and even vomiting. In an emergency, a shot of adrenaline can help reduce severe symptoms. Some might even opt for immunotherapy, which involves introducing small doses of venom to the immune system so the body doesn't go crazy the next time a bee decides to attack. So there you have it, all you could ever need to know about allergies. Now you can go out into the world being a complete expert, or at least close enough. And remember, keep away from those pollinators.